Good morning and welcome to Grand Rounds. This morning we're happy to welcome Dr. Diane Robinson. Dr. Robinson is a neuropsychologist and the program director of the Cancer Support Community in the Integrative Medicine Department at Orlando Health UF Health Center. She received her master's and PhD degrees from the University of Central Florida. She is currently president of the board of the Central Florida Brain Injury Support Group. This morning, Dr. Robinson is going to speak to us on a research update, yoga in pediatric populations and for provider health. Please welcome Dr. Diane Robinson.
Thank you so much, everybody. I'm delighted to be with you this morning. Today, I do need to start off by saying I have no disclosures. There's no yoga company paying me to talk about yoga this morning. It doesn't really happen so much in this field. So we are going to look at the field of integrative medicine this morning, try and understand where does yoga fit within that type of medicine, how can it positively impact your patients, and finally, how can it positively impact yourself? So the evolvement of integrative medicine is really just putting a label on what we have all instinctively known for since physicians have been around, which is you need to look at the whole person. It's not just about the physical state, it's about the mental state, where are they living. And so the World Health definition of health changed recently to reflect that health is not just a state of complete physical health, but it's also that mental and social well-being. So with that in mind, the field of integrative medicine has been developing over the last years quite rapidly. And it's now this idea of practicing medicine with every tool that's available. So that means the development of a relationship between the practitioner and the patient, where you're looking at what other kinds of therapies may be able to supplement the standard medical treatment, what other things could help this patient. And so it spans really a large track of health. So let's have a look at this model. So this is a model that I was trained in, and when I was first invited to come to Orlando Health, it was the model that I brought along with me. It's this idea with oncology, the integrative medicine consult is encompassing everything that we can offer a patient. So in other words, at the top you have your standard therapies where you're using the latest in chemotherapy, getting patients into research. You're using the most advanced surgical techniques that are possible. You're bringing in radiation, things like the proton center. So staying at the cutting edge of medicine as a field and pharmacy and making sure all of those there, but then looking at the person and starting to try and understand how they got to this position in their lives, what else is going on there. So if you trace the way around this like a clock, you'll see that we start looking at sleep. We know the importance of sleep, so sleep hygiene measures are starting to be involved there, trying to get them to get some rest and restoration. We then look at what's going on in their life. Is there some environmental exposures going on? What can we do there in the home? We try to act as an advocate for this patient, linking them up to anything that's in the community that will help change their situation. And that might mean getting them into nutrition classes. It may mean linking them into social services. So through that, we use social work, but we also teach the patients to become an advocate for themselves within their own friends and family. I'm not sure how many of you have reached out to your patients and said, well, who else could help you right now? You're really struggling, and they'll tell you, I couldn't accept offer from my neighbors. So part of it is teaching them to say, yeah, actually you can say yes, you can accept that. That's quite appropriate, and having people who a lot of times have just been caregivers themselves and have become patients to say yes to help. We have this support groups, we try to educate, and then we have these complementary practices that work in tandem with Western medicine, things like music therapy, Tai Chi, yoga that we bring on board to help people move their bodies as well as calm their minds. We use the spiritual side, meditation, chaplaincy, and then bring on psychiatry for those people whose mental health is really getting in the way of them getting better. We rounded up with things like smoking cessation, linking patients to that in the community and running that here, and then finish it off with all of the other services that are traditionally offered within a rehabilitation program, things like nutrition, exercise, and then have the final therapies of acupuncture and massage. So yoga is one of the ones that we have a lot of research on the adult population. There's been research going on now for well over 40 years into yoga at the research level in universities. And the studies, first of all, focused in on things that you would recognize to be associated with light exercise in the first place. So we see increases in flexibility, stamina, muscle strength. We also see changes in posture, which actually helps reduce pain in some cases. We know that it strengthens cartilage, joint breakdown. It's very good, like all weight-bearing exercises, when it's your own body weight, for bone health, improves circulation, heart rate becomes steadier, lowering that blood pressure, balance, lung capacity, sleep gets better, digestion rate, stress control. So all of this is extremely well supported in the adult literature. So when we were looking at bringing integrative medicine into the adult side of the hospital, it was certainly one of the first things that we kept and encouraged our patients to attend. So part of the benefits of yoga that we see in adults is really linked to the activation of the parasympathetic nervous system. So the impact really begins with this idea that the autonomic nervous system itself has become overactivated in the sympathetic division. So what we find then with this idea of chronic stress, whether it be from circumstances of your work or whether it be a chronic health condition, starts to activate some of the slower responses to stress. And you have this chronic situation that develops. So those slower acting responses to stress, things like the mineral corticoids, glucocorticoids, start to have some long-term impact on the system. So the most famous of them that you hear sort of on a regular basis these days is cortisol. But there's also other ones that are implicated in this system. So what we find in chronic stress, the activation starts to change the way our system functions, and basically we have levels of cortisol in the system that start to change things like our immune response. It's all linked to the hypothalamic pituitary adrenal axis, and what we know is that once this starts to have this neurometabolic cascade, and it's there chronically, then there's some permanent changes that start to appear in the brain, particularly in the hippocampus itself. What happens is those mineral corticoids, the glucocorticoids, particularly again the cortisol, really has a strong affinity for the hippocampus. And so we start to see shrinkage in the hippocampus and a growth in the amygdala as the hippocampus is suppressed. What this means then is the idea of your response to stress starts to change, and it becomes you become more readily anxious, more readily fearful because of the growth of the amygdala. What this is then doing to your system, if you think of it as a systemic approach, is that the amygdala then is in control, and you start to see a lot more excitatory processes in the brain. Glutamate is really then functioning all over the system, and you see a suppression of GABA, which is your primary inhibition neurotransmitter. So under these chronic stress conditions, you'll really start to see that this is impacting almost every system in the body. We know, I've already mentioned immune suppression, but we start to see some changes that take place in your gastric system. We start to see linkages, for example, finding difficulty with patients with maybe constipation and diarrhea, constipation, all of these things, we start to see this with this chronic exposure to cortisol in the system. So the yoga-based practices is hypothesized is you, through yoga, actually start to stimulate your parasympathetic nervous system through the vagal response. Now, this is a wonderful response that is actually under our own control. So I'm sure you all remember the autonomic nervous system is divided into sympathetic and the parasympathetic. And within those, you've got this capacity to actually control some of those processes. And it's something that really very few of the higher order mammals have. And we as human beings are able to control our breath, even though it's an autonomic and automatic process. So for example, as you're sitting there listening to me, I'm sure you're not saying to yourself, okay, breathe now. You're not saying heart rate, keep going. But it is something that we can take back under our conscious control. And some of these earlier practices of yoga, if you look back in history, the movements, the postures that we associate now so much with yoga weren't really what was driving it. The whole idea was breath control and control over thought. And so a yoga practice is a little bit different from those other gentle exercises that we have, because there is so much breath control and mind control that is attached to it. And when you start to bring that on board and stimulate your parasympathetic nervous system, then we begin to calm down that sympathetic nervous system and hopefully have some other responses that increase the GABA activity and therefore kind of bring back our whole system to more stability. So really what we're talking about is this idea of homeostasis and allostatic load. Bruce McEwen, who is probably the most famous researcher in this field, termed allostasis as the actual amount of energy that you have to give your system to return it to baseline. So your body, it has a nice, as you well know, it has a function for its system that it likes to stay put at. It's the best way to describe it. And so when any demands are made on it that starts to change that system, there's a greater stress that's put on the body to bring it back down. So the whole idea is to try and keep it in a nice stable base so the body itself has to do less work. So really this is the hypothesis of why we've seen so many positive changes in the adult literature based for yoga. So what do we see in the peds? So when I was asked this question today, as you know, I'm in the adult field and I really hadn't looked at the pediatric field of yoga and the research and the evidence base that what's going on there. So I was really intrigued by the question. And so we started off by looking at one of the big review articles in this area. And we saw in that review article what really is the problem with a lot of integrative medicine practices, not just with yoga. We have small n's. The studies aren't randomized and controlled studies at all. And sometimes the quality is just really poor. And they self-select into the study. So it's a general issue with integrative medicine as a whole, and particularly when Birdie first did this article and he was looking back over from 79 to 2008, this was pretty much the prognosis, is that there seemed to be some really promising research that was starting to develop in this field, but really the randomized control trials and the 5 non-randomized control trials that were considered good enough to review, really the methodology was not great. But they had started to look at yoga's this idea for physical fitness for pediatric populations, look at the cardiovascular effects that it would have, see if there was any changes in motor skills and mental health. And also looked at both outcomes with prenatal yoga. In general, in yoga across the board, there's very few adverse events that get reported. But again, this poor quality of studies of 2000 up to 2008 was really the hallmark. So we started to review, well, what's happened since 2008. So we have seen an increase in the number of studies that are out there at this point. It's really starting to stimulate a lot of interest, particularly in the area of pain. And in fact, pain right now is a very hot topic, as you all know, with our opioid crisis. And so I think this area is going to get more and more research coming into it. Right now, UCLA, they have a really great integrative approach to pain in children. They have a very comprehensive center, and they have 2 trials that are going on for rheumatoid arthritis and IBS. They both seem promising right now, but we actually haven't got any results. No results have come in yet, so we're still hopeful that that will actually see some changes, because they've been reporting that there's some good effects in this. With that particular population, with RA, it's what we also find a lot as we went along to do this review in the pediatrics. We find that the children population that they're looking at get pulled out of these studies very quickly, so the attrition rates are quite high. The reason is that children become sicker, parents get concerned about the loss of education and they want to get them in as much school as possible. Then there becomes transportation issues. So we really see high attrition rates, and that's one of the reasons why we have some of those methodological issues. So it seems like we've got some interest in the pain area. And the other area that's coming up quite strongly is quality of life overall. So if you think about the strategies that are involved in yoga, you've got the physical and the mental. So it seems that giving children techniques to help quieten their minds, particularly when they're in this very stressful time of an illness and there's so much going on around them, it's giving them another tool to cope with it. So this particular intervention was looking at lots of different, hopefully, variables that they were going to see improvement in, but really the one that was a significant level was improved quality of life for both groups in this study of cancer patients, pediatric cancer patients. So quality of life definitely seems to be an area that you're going to see more and more research on. So I already mentioned rheumatoid arthritis and also IBS, but we're finding now the research is really spanning across diagnosis. It was quite broad when we were looking at it. So for example, here Moody and et al. Was looking at pain in sickle cell patients. Obviously with sickle cell, it is the hallmark of this disease, these excruciating crises of pain that they experience. So when these children were hospitalized with pain, the question became, well, can we help reduce that pain with sessions of yoga? So they did several sessions of yoga with this one, but really they found the initial one had the most impact. So that very first yoga session where suddenly these children were being taught and taught how to control their breath, how to focus on different areas of body away from the pain, release and relax. Some of that had really a significant impact in comparison to the control group. So this one did have a control group. And the control group, they were actually using some of the same practices, listening to music in. So it was quite a nice reduction in pain that they found for that group. So another diagnosis that's been looked at is cystic fibrosis. Again, very painful condition. This one was a 10-week program. Another small N, unfortunately, it seems to be characteristic of this research area. So they found less anxiety, again, that pain reduction in the joints, and the patients themselves seem to be able to start to breathe a little bit better. So finally, another one that we looked at across was the pediatric burn survivors. With this one, they did not find a reduction in pain, but a reduction in anxiety. So the area that we focus on most, obviously, at the cancer center is cancer. So we did find there were actually similar interests in the pediatric field, and there were more research articles done with cancer patients than any other diagnosis when we were looking across this field. So what we find is the study by Wirtz, again, was a very small study. When I'm saying small, 8 patients. So we know with that there really isn't enough statistical power, even though it's published. So I will put out a word of caution there because of this. But nonetheless, those 8 children did experience some significant increases in mobility, but there was no control group. But they did find more flexibility and, again, more quality of life. So we start to see these really as pilot areas. What we're really needing, I think, across this field is more randomized controlled trials across multiple centers, because you just can't get the ends that would make these more significant. The other thing that we're really finding across them is that right now, yoga itself has different practices, and I'll maybe have our yoga instructor who's with us today explain that. But we have things like Hatha yoga, Iyengar yoga, which are a little bit different in philosophy. So we're finding across these different studies, they're using different practices of yoga. So for one, for example, the one I mentioned for the pain and the burns, those children were actually at a burn camp. And so how they actually incorporated yoga was extremely creative. But I haven't heard of a Harry Potter yoga anywhere else. But they did actually develop a Harry Potter yoga. And how they did the guided imagery with the children was they had the children create their own Patronus, for those Potter fans that don't know what that is. And so then the children were trying to control their Patronus with their minds. So there's a lot of creativity and use of yoga in different ways, but there's no standardization, so it makes putting sort of sweeping statements about all of these different studies together a little bit difficult. With the hook and all, the yoga for children and adolescents, the adolescents went up to 21 years of age, so we're going out of the pediatric population, and again, it's a problem with getting enough people in these studies. But after the 6-week intervention with the younger children in particular, they found less fatigue, less anxiety, some better balance, and some better sleep, but it tended to be with the younger children than the older ones. So what are you doing here at Arnold Palmer right now? Hopefully you're all aware that you do have a yoga practice here. It is not anything at this point where you can say it's regular, because it's simply once a month. But it is a program that appears to be extremely popular from what I've heard when I was doing my own little research about what are you doing here right now. And they have yoga stations, and the yoga therapist who leads it is very passionate about working with the children, and so she has to try to adapt to the hospital population little segments so the children can come and go if they need to go to different practices. So it does happen once a month, and you will see these signs around. So if you have children who might be interested and you want to explore this possibility of using yoga here with them, this would be a great place to start. In terms of research, we are actually beginning research ourselves at the Adult Cancer Center, and I'll be introducing Nancy Sinton, who will be leading that for us, will be the lead yoga instructor, because yoga itself is now moving in more and more into the mental health field. Particularly with depression and anxiety, we have seen a response that's quite large. In the mild to moderate anxiety and depression cases, we're now seeing a shift, and there's a couple of yoga programs that have been developed, one just recently in London, England, where I'm from, that Nancy went to and is trained in, where they're using this 8-week program, and they have really focused on the mental aspects of yoga, and we hope to be starting recruitment for that very shortly for the adult cancer population in January. But I think this field is wide open right now, and if anyone is passionate in this room about finding different ways to help the children cope with pain, this might be a really good place to start. I think there's a lot of potential that we're seeing, but again, that N size right now, and the poor methodological, there's different problems. There's no randomized controlled trials, the small N's, the lack of a detailed description of the yoga practices that they're using. It means that there's a lot of opportunity available. Okay, so what about for everyone who's in this room? How could yoga help you help your patients? Tate Shanafeld is probably the leading voice in this movement right now of helping pay attention to physician burnout. He sent out a huge amount of surveys about work-life balance and found out that the burnout rate is really very high in physicians, higher than almost any other vocation that's out there, and he's leading the drive. I've had the pleasure of meeting him, and he'll be the first to tell you, if you go tell your physicians they need to do yoga, you're really missing the point. So I'm not telling anyone here to go and do yoga to do this, because the system itself, how medicine has turned, it's incredibly complicated. There's so many demands made on all of you every day that adding one more thing or feeling that pressure to have to add one more thing may just increase the stress burden as opposed to lighten it. So where he suggests that we start is by looking at medicine as a whole and understanding what is driving the burnout or the depression rates that we're finding in physicians. So in terms of depression rates, we find in certain fields of medicine, the depression is a little bit higher. So it's highest, for example, in emergency room physicians. In fact, pediatric providers, you're one of the lower rates of depression. But suicide risk is extremely high. It's one of the highest in the population for both physicians and for medical students. We have very, very high rates. And so stress is really something that is so important to pay attention to. Now, I'm not saying, again, to use yoga as your only stress reduction technique. There are others. But really to look at yourself as a system and try and figure out what would work for you within the limitations that you have in your own life. It may be that you could practice yoga. It may be that you could go running. It may be that you find stress reduction just talking with your friends and family and making time to groom your dog. Whatever it is, find what helps you bring your stress level down and do it. Because if you remember when I was talking about the long-term effects of stress, one of those is that immune suppression, and we find that you become much more likely to become sick. There's very famous studies with medical students, for example. We can't do those anymore in psychology, but they sounded so much fun to have after medical students are under the pressure of exams, final exams. So they would actually, we were able to do this, Carnegie Mellon did this, a researcher called Sheldon Cohen would line everyone up and spray you all with rhinovirus and figure out who got sick after the exams, and sure enough it was the folks who were actually reporting most stress. We can't do that so much anymore. IRB just wouldn't let us play in that way, but the point is, hopefully you'll understand that this is something really serious, and maybe we can look at processes with the hospital itself to help reduce stress, but also Just look within yourself and figure out, well, what can I do, and prioritize accordingly. So, as I mentioned earlier, the reason why we're thinking that yoga as a whole person approach is that it's really trying to get to all of those aspects, but it's not the only one. You'll see in front of you one of the offerings that we put together for the community that's free of charge for anyone in this community that's impacted by cancer. So we have yoga classes free of charge. We have Tai Chi free of charge. We have support groups free of charge. We have nutrition services free of charge. We have many different aspects of education just so we can tap into wherever that person needs the help most. There's not one size that fits all, not for yoga, not for anything in integrative medicine, but the point is to try and find the approach that resonates most with yourself and then most with your patients. And we know that offering this broad array can really help just connect people over and over. So with that, one of our key connectors that we have at the Cancer Center is Nancy Sinton. She's a registered yoga therapist, which is very different from your normal yoga instructor, a lot more hours. And she actually will be stepping us through something that this is not only about research, but it's also about the experience of yoga. So with that, I'm going to hand it over to Nancy.
Thank you. I'm just going to start here, but then I'm going to go in front. And weirdly, when I go to... Okay. Welcome. I just want to continue to build upon what Dr. Robinson just said to you about yoga. And I did want to make a point about yoga versus yoga therapy. First of all, whether it's yoga or yoga therapy, what it means is we're going to include movement, breathing, relaxation, and meditation. And on top of that, mindfulness. All of that's going to be done in a very mindful way, which basically means paying attention on purpose and being present. So you can do that in no matter what you're doing. But we're applying that onto the yoga as well. So yoga versus yoga therapy, you need to be careful. I forget which the next one is. Okay, not that one. I'm just going to go back. Yoga. So the point I want to make to you as physicians or physicians in training is that Diane made a point, or Dr. Robinson made a point of how important the research is showing that yoga can be helpful. But it's not so helpful just to recommend to a patient to go to yoga, okay? You need to know what you're recommending them to go to. So yoga, you can find yoga, a lot of yoga, especially in the Orlando area and really throughout the United States. But all yoga is not for everyone, okay? Power yoga, Ashtanga yoga, things like that. They're great for people that are healthy, but not so great for people that are not healthy. So then you want to start looking at classes that might be labeled as gentle yoga or yoga basics, but even those classes might not be for some of the patients that you see. So yoga therapy, a yoga therapist has a lot more training than a yoga teacher, but it's just more in-depth training on health issues and how to apply yoga to those health issues. So, for example, I teach the yoga here at the Cancer Center to cancer patients, and so I have to lead that class much differently than I would a class at a yoga studio. This past Saturday, I did 3 yoga classes in Winter Park for the Brain Injury Association of Florida. So that population was very different, even than the classes that I teach at the Cancer Center. There were people there in wheelchairs. Some were looking at me but couldn't even move. But what I found is that everyone can do yoga. The people that were, what I said, because I could tell some of the people couldn't move. But I asked them to envision that they were doing that. Imagine that what I was saying, they were actually able to follow those directions. And when we got to the point of a relaxation, we were at the Winter Park Civic Center, and it looked out over a beautiful park. and there was a path there. And so the visualization I did with them was to imagine they had their eyes closed. Imagine yourself walking in a park, just like the park that we're in. And then I guided them through the park, and afterwards I asked people what was their favorite part of the yoga class. And one of the ones that couldn't move and could barely talk, but through their caregiver, got me the message that the relaxation was his favorite part, because he could visualize himself walking through the park. So every time I teach a class, I learn something from the patients. So anyways, so I have to gear as a yoga therapist to whatever my group is. And so my group today is you, and we talked a little bit about physician burnout. So what Dr. Robinson said is true. You may not like yoga, so I'm not going to try to push yoga on you, but I would like you to leave here learning a little bit more about yoga. My goal is always to teach skills that people can take away and do at home. You know, if you can't fit a yoga class into your schedule, can you do 5 minutes of breathing? Can you do 5 minutes of meditation? So I just want you to understand these little tidbits that you could be doing on your own, skills to help you. And if you can get to a yoga class, great. So as we said, there's some type of yoga for everyone, and this is just showing, I'm going to do a little practice with you. Maybe it'll be 5-10 minutes, but that we can do yoga sitting in a chair, and a mat, in bed. If all you can do is wiggle your fingers and your toes, you can still breathe. If you're still alive, you can still breathe, and I can teach you to breathe a little bit better. So this is what often people think of yoga, is that you have to stand on your head or do some of those fancy poses that you see in the pictures, but it's not true. If I have only 5 minutes with someone, we're going to do breathing and maybe a little bit of relaxation. It's the breathing that's the connection between the body and the mind through the autonomic nervous system and through other impacts that are happening in the body. So let's do a little practice, okay? I'm going to walk around. But the first thing I want to do is I want to take a minute and I want to assess how you're breathing, okay? So what I want you to do is to make sure you're in a relaxed position, okay? You need to sit up straight, okay? Part of yoga is that we're working with the spine. And as we're doing these practices, it's important to have the spine straight, okay? I'd like you to have your eyes closed or downcast. If you're uncomfortable with closing your eyes, just have them downcast. Just begin to connect with your breathing, okay? Let yourself relax. Notice how you're breathing. Bring your attention to your inhale breaths and also your exhale breaths. And notice if they're different. Is the inhale longer than the exhale? Is the exhale longer than the inhale? Are they equally both? Is the inhale and the exhale the same? Is the breathing choppy? Is it smooth and steady? And without opening your eyes, I'd like you to put your right hand on your belly, on your navel, and your left hand on your chest. And continue to connect with your breathing. I'd like you to notice where you're breathing. Do you feel the breathing in the chest, on the left hand that's rested on the chest? Do you feel the breathing more in the belly? Do you feel the breathing both equally? Or is one more in the belly or more in the chest? Now I'm going to time you now for 1 minute. Keep your eyes closed, stay connected with the breath. And I want you to count the number of breaths you are taking in a minute. So taking an inhale and an exhale is 1 breath, okay? And then continue to count. So when I say start, I want you to count, and I'll tell you when to stop. So now, begin to count your breaths. All right, stop. I just want you to remember that. How many people had five or less breaths per minute? Okay, no, and another thing is I want people to be honest and not judge themselves. It's no big deal. I'm trying to bring some awareness to the breathing. How many people had 5 to 10 breaths per minute? And then how many people had 10 to 20 breaths per minute? Okay, so quite a few. Okay? So the point I want to make there, and then we're going to do a little bit of breathing practice, is that a study was done, and breathing at a rate of 5 to 6 breaths per minute is the ideal breath rate to regulate the heart rate variability. Okay, we're trying to bring resilience to our heart, our nervous system, and the heart rate is part of that. Okay. So 5 to 6 breaths per minute, if you can get yourself breathing at that, when you start to go above that, you start to feel that sense of panic or anxiety, well, especially above 10 breaths per minute, okay? So how many people felt the breath more in the chest area? Okay, how many felt it more in the belly area? How many felt it equally between both? Okay, well, we didn't see all the hands. Some people didn't want to answer that. Okay, so what we want to do, at least from a yoga standpoint, is to breathe deeper into the belly. We teach the deep belly breathing. And I'm going to teach you a practice to just teach you the skill to bring your breathing, because it's going to take practice, to bring your breathing down to 5 to 6 breaths per minute, okay? So come back into your position of sitting up tall with your eyes closed or downcast. And you don't need to put the left hand on the chest, but I would like you to bring your right hand to the belly, okay? Because it draws our awareness to the breathing, to the belly. So begin to breathe now, and I'm going to count, okay? And I want you to follow my count. Okay. So relax your abdominal muscles so we're all doing this together. So inhale for a count of 2. As you inhale, your belly's going to expand. 1, 2. And now exhale for 2. 1, 2. Inhale for 2. 1, 2. Exhale for 2. 1, 2. Inhale for 2. 1. Belly expands. 2. Exhale for 2. The belly draws back in towards the spine. 2. Inhale for 2. 1, 2. Exhale for 2. 1, 2. Now let's bring it to 3. Inhale for 3. 1. Belly's expanding. 2, 3. Exhale for 3. 1. Belly draws back in. 2, 3. Inhale for 3. 1, 2, 3. Exhale for 3. 1, 2, 3. Inhale for 3. 1, 2, 3. Exhale for 3. 1, 2, 3. Now let's try 4 and 4. Inhale for 4. The belly expands. 2, 3, 4. Exhale for 4. The belly goes back in towards the spine. 2, 3, 4. Inhale for 4. 1, 2, 3, 4. Exhale for 4. 1, 2, 3, 4. Inhale for 4. 1, 2, 3, 4. Exhale for 4. 1, 2, 3, 4. Now continue to do the breathing on your own, feeling your belly expanding on the inhale and drawing back in towards the spine on the exhale. I recommend that you do this breathing 5 to 10 minutes every day. I personally do it before I even get out of bed in the morning. So I know that I'm starting my day breathing deeply. If If you do it every day, it becomes your natural habit. It's this counting at the breath rate of 4, inhaling for 4 and exhaling for 4, that will get you down to the 5 to 6 breaths per minute to help you stay calmer. And so that's a little tip that you can do on your own, okay? I don't have a lot of time. I would, if I was able to, I would do a little practice with you in terms of make you stand up, do some things. Then I would do breathing exercises with you. Then I would do a relaxation and a visualization with you. And meditation, I want to make a point about meditation, is that it's very tricky to recommend to somebody, go meditate, especially if they have anxiety or depression, because their mind's all over the place. And the last thing they can do is to try to focus on a certain thing. So in the 8-week course that Dr. Robinson mentioned, that the last 3 weeks are about different practices of meditation. We're doing all sorts of things in week 1 through 6 to lead up to that, right? To get them to a point where they can close their eyes and meditate. And that includes the different breathing practices. So I taught you one breathing practice. I could easily teach you 6 different breathing practices, but I gave you a tool that you could use on your own. So I think what we're going to do here is, so we want to leave you with this no matter where you are in your life, it's the perfect place to start. So let's begin now. So we're going to open this up to some questions, and I'll be happy to answer. But I would like you to know that when you're I highly recommend yoga for you and for your patients, but know what you're recommending, okay? And I'm here at the Integrative Medicine Department, so if you have any questions, please let me know. If you want me to come to talk to you or another group more specifically about the different types of yoga, that was not the purpose of this session, I'd be happy to do that. Okay.
I have a question coming from it. First, thank you for coming to sharing, especially I think that tool is always helpful, especially for busy physicians. And that's kind of where my comment/question comes. I remember as a resident, even as an attending, we're on call for 12, 24 hours, 24 hours a day. Our phones have to be on. And I find that when I look up yoga classes, and I love yoga, I was discouraged because my phone has to be off. And unfortunately, sometimes that's just not possible. And also the classes are rarely in times that we can go, meaning like 5 a.m., 9 p.m. So my comment/question would be, I would love it if there was a physician yoga or a provider type yoga that we were allowed to keep our phones on, even though I know it's against meditation, but I don't know if you noticed, but you saw some residents get up because unfortunately it's just the way it is.
Right.
So just like you kind of tailor it to the TBI patients or to the cancer patients, I wish there was a yoga tailored to physicians where if we had to get up and go into our phones, it was allowed and not kind of like, I don't know what to judge it, but that it was accepted, just like everything in yoga is kind of accepted. So that's kind of my question.
I would like to see that too. I'll do it.
The way to integrate this into resident practice. That's one of the reasons people don't go.
We have a yoga class in the cancer center for providers that was started at the request of a physician. So I don't know if they keep the phones on or not, but I know that
What time is
it's 4:30 on Tuesdays.
In here. It's for team members.
Those are for team members, and so you're absolutely welcome if you do want to come and try it. It's at 4:30 on the 4th floor of the cancer center, but that's hosted by Integrative Medicine, and it's not going to be in your brochures because that's a cancer support community for the whole community for cancer patients. So we do have in the Integrative Medicine Department, we provide some services. So for example, on Wednesdays every month, we have a 4-week session of mindfulness-based stress reduction that condenses the John Kabat-Zinn program to 4 weeks, so it's easier to fit into our lifestyles. And then on Thursdays, we have Tai Chi for providers as well.
And I suggest, based on, to piggyback off what else you said, if you go, I'm not the instructor for that class, but it's another excellent instructor, just let the instructor know. If you feel like you might have to be called away, it's like, do you mind, I have to keep this on for this reason. It's very helpful for us as instructors to know that. Any other questions, Jeffrey? I'll be right back to that.
For the yoga for kids, Arnold Palmer, do you know in general when that is? And is that just for patients, or is it for patients and their family members?
I'm not sure. I was told it was just for children, the patients, and it's once a week. I believe it was on a Thursday morning.
It's once a month.
Once a month on a
It's the
Thursday.
first Friday of every month.
Then,
Okay, perfect.
First Friday. Thank you.
And since it's in a playroom, it's just for the patients. We do encourage parents to participate if they want to, but we can't have siblings in the playrooms. So as
Thank
of now,
you.
that's where it's at.
One more question.
Sure.
So, as you mentioned, we shouldn't just recommend yoga for our patients. So, if we do have a patient we think yoga would be helpful for, how should we go about finding them the resources?
That was my question.
We can,
Like, is there a YouTube channel that they could maybe do?
well, I would think that, well, there might be, but I think we would want to try, I could help you find something in the local area. I mean, over time, we're strapped with resources. Over time, it would be great if we could develop a program that you could use. But I do know a yoga therapist in the Orlando area that focuses on children. She actually is the one who teaches this, but she teaches it, I could just call the integrative medicine, they'll connect you with me.
Yeah, you can connect them as well.
Yeah.
Yeah.
Okay. So, if we have a patient, call integrated medicine, see if we can get them.
Yeah.
Yes, we'll connect you with me and I'll give them the name of
Well,
some people that work
Amanda-
with children.
Is it best that they could contact you directly about? Yeah.
That's fine, absolutely. Amanda.harris@orlandohealth.com. I can pass along that contact
Did you get that?
information.
Are you talking about Ella Duke? Yeah.
So
She's
Amanda.
a colleague of mine, but she works with children.
Do you have any formal collaborative program that you work with palliative care and then for therapy for, say, patients with chronic pain?
Actually, we were talking about this yesterday at the Cancer Center. We had a palliative care program that addressed some of it, of this with guided imagery, for example. We don't right now. We are working on it, particularly with the chronic pain right now in palliative care. There's a lot that could be done without increasing any medication to help them cope. There's a lot of strategies. So we're definitely developing this right now, like literally. So we'll have it soon, but not right now. You want to talk after? Yes, we can definitely. I know you have a great child life program here, and some of the skills that they have within there might be able to be adapted readily to a palliative care program. But it's really taking the resources that maybe you have and using them creatively already, as opposed to a whole new program. So, for example, a lot of my background is psychology. I'm a neuropsychologist. So we do a lot of, pain-specific interventions that are using imagery and helping people do that. So a lot of LMHCs, for example, within your program may already have that training as well, and it's really effective with palliative care, particularly when there's chronic pain, to have them build that sort of resilience internally. So because there's always reaching a point where the pain, you can't give them more pain meds, but you could give them something else to help.
Any other questions?